Hello everyone, welcome to my channel. Today I want to talk to you guys about interesting entity, a stroke timeline, what will happen on MRI in acute, subacute and chronic phases of a stroke. So as we all know, the hallmark of the stroke is this, the most important sequence is diffusion weighted imaging, or the DWI sequence. As we see, there are some areas of increased restricted diffusion, as you see here in the right parietal subcortical white matter. And then we have to look at the DWI sequence with this ADC map. You see that corresponds to those areas that they were bright. Now we see darkness on ADC map. So this is true restricted diffusion. And then if you look at this sequence, which is FLIR, we see the FLIR sequence because we know that this is a CSF which is dark, and then the scalp is also dark here because we have FLIR FATSAT in this sequence. In our institution, basically, we do the T2 FLIR sequence with FATSAT. You have this option. And then, so basically, on those areas that we had restricted diffusion, we see T2 FLIR hyperintense foci. So what is restricted diffusion means? Basically, this is a manifestation of acute infarct when we have some parenchymal that they are dying, and then we have cytotoxic edema, and then it's going to be, they like decrease the movement of the water molecules, and it's called basically restricted diffusion of those water molecules. So acute infarct equals to increased areas of restricted diffusion. Make sure always look at the ADC map on this one. We should have correlation with these dark signals, and this is going to be acute infarct. Okay, after 1 week, when we have this acute infarct, we're going to go to subacute phase. When we go to the subacute phase, we gradually decrease these dark signal on the ADC. So it's just going to get bright, but we still might have seen some areas of like DWI bright, but it's just not going to have the darkness on ADC map. Then we're going to see some areas of enhancement. So if you look at that, so this patient had like the different areas of infarct. I just want to show you another area. We should just go higher up. In this area, if you look, we see some areas that they are basically bright on ADC map over here. And then if you look at this sequence on FLIR, we have some areas of like cortical or gyral T2 FLIR hyperintensity in the right parietal lobe. And then we don't have hemorrhage. This is the susceptibility weighted imaging. But on post-contrast sequence, in those areas, we see areas of like enhancement. So this is gyroform enhancement in those areas. The cortex is enhancing, and this is and has T2 FLIR hyperintensity. This is the phase of subacute infarct. So the hallmark of subacute infarct is the restricted diffusion goes away gradually. You're not going to see dark signal on ADC. You start seeing enhancement on the cortices in the region of involvement. So make sure don't just mistake this for other processes like neoplastic process or something else. Actually, we have to know the history, but this gyroform enhancement in this patient that has a history of multiple sclerosis basically shows subacute infarct. And then finally, we're going to look at the chronic infarct. So basically, we have those cells that they died already, and that brain parenchyma is lost. And then we have some cavity in those regions. So this is the area that we call it cystic encephalomalacia. We see that there are like some gliotic reaction in the area of prior infarct, and there is some volume loss. And then, of course, we're not going to see any abnormal signal on the DW or ADC map. We see some hemosternal staining. So in areas of like infarct, sometimes we just see this particular hemorrhage that is just shows prior insult in this region. And then if you look at these T1, this is a T1 without contrast. You see that those areas, they have these areas of like T1 hyperintensity. This is called laminar necrosis, which is common manifestations of the chronic infarct. And if I look the same area, make sure don't mistake these areas for enhancement because these are already T1 bright on non-contrast T1. So basically, this is laminar necrosis and other manifestations of chronic infarct. So keep in mind, we have basically 3 phases of stroke on our brain MRI imaging. On acute phase, we have increased restricted diffusion, we have T2 FLIR brightness, and we usually don't get enhancement. If it gets just more progress with the subacute phase, we're going to see enhancement. And if we get to the chronic phase, we are going to see volume loss, encephalomalacia, gangliosis, and laminar necrosis. Thank you.